Okay. Seeing some people coming in, so just wait a couple of minutes. Moving over from the previous session. There you go, Tash.
So excited. Thank you, everyone. I was commenting on all the emojis coming through at earlier sessions, and I'm so happy to see more coming through now.
Okay, one more minute. Okay. Welcome, everybody. Thank you for joining this session on caregiving and compassion fatigue. My name is Nels Friets. I'm an advisor with Calm Collective, and I'm honored to be joined by Dr. Tash Mirando from Osler Health and Ling from Eagle's Mediation and Counseling Center. I will let the two of them introduce themselves in just a minute. This topic is near and dear to my heart as someone who's been a caregiver for many years. I'm looking forward to learning what I have struggled through, put some names to it, but more importantly, how to deal with those challenges from a professional point of view. So with that, before we get started, well, everybody put your questions on the Q&A or the chat. We'll get to those throughout. Perhaps each of you can introduce yourself. Tash?
Sure. Hi, everyone. I'm Dr. Tash. I'm a British Sri Lankan general practitioner, and I work now in Singapore at Osler Health International. I recently moved back to Singapore, and one of the main reasons is actually to be closer to family who are in Sri Lanka and getting older. Not that anyone still listens, but it's definitely worth being closer. I just wanted to say, big thanks to Calm Collective Asia for the invite. I'm a huge fan of the work Sabrina and the team are doing, mainly from a breaking stigma of mental health in Asia, which it's so important. And I feel, especially keeping in with this topic, it starts with caring, which is a personal matter, but I think a universal concern. And every single person will need to and or provide care to someone in their lifetime. And probably more than once, actually. And something else that's quite close to my heart is historically, it's actually known to affect women more. And as a female doctor, I feel empowered to actually improve access to mental health care and support wherever in the world, and should be globally. My colleagues at Osler Health and I see actually many people with varying mental health symptoms. And just really a thumbs up, because it's seeking help is the first step, and I would encourage everyone to do this.
Thanks, Tash. Ling?
Okay, good afternoon, everyone. Thanks for taking this beautiful afternoon off to join. And may I say congratulations to Calm Collective, to Sabrina for pulling off such a wonderful conference. I'm sure you are enjoying yourself. And thanks to all of you tuning in today for this topic. Okay, I'm a counselor, and I've been a counselor for more than 20 years. And in my profession, I hear a lot of stories of how people care for one another. And it has impacted me a lot, because through working with all this client of mine, hearing their story, they teach me to a lot of many important things in life. So I count myself always a privilege to be able to share and journey with them and grow along with them. And that's the things that keep me going, because as I listen, as I work with them, I myself am being cared for while I provide care. And I think it's a wonderful journey to be able to do that along with the people whom I have the privilege to share life with. So thank you very much again for this platform. And I'm sure this afternoon we'll have interesting conversation with one another.
Sure. Thank you. So let's start with a couple of the terms that float around. Compassion fatigue, caregiver burnout. They sound similar, but there's a difference. How should we be looking at that? Ling.
Maybe I start first, because it's something that's close to my heart, having been working with people for 20 over years. I mean, I have to be honest, I do feel tired. And I think that is what I would term as compassion fatigue. Even though I start with passion to want to help people, but sometimes as you go on, you keep hearing stories of sadness, of struggles, of pain, or even sometimes I hear story of abuse, which is trauma. It can also affect me because of the fact that I hear it day in, day out. And to me, that is called compassion fatigue, and is also known as secondary trauma. It's like you keep hearing the same old, stories of all this, that it has an impact on you, a negative impact. And that to me is natural, is part of it, but I think we need to deal with it and we need to recognize it. So to me, that will be the fatigue to begin with. And it evolves slowly. Sometimes you're not aware, but your body can tell you. So I think this is where we need to understand. And of course, burnout is a slightly different thing. Burnout is almost at the point where you are very tired, that you no longer think you want to hear, and you're kind of not wanting to care and want to just leave everything. So I think that is serious. That to me is the main difference between fatigue and burnout.
Okay. Tash, anything to add there?
I mean, really stemming, Ling, from what you said, if somebody says PTSD, I don't think there's many people out there who think that could actually be caused by caring too much. There is such a thing as too much empathy, and most of us can't actually help ourselves. And it's usually not a bad thing, but it's making sure we set our boundaries with regards to how we cope with it, because each person's different. I have varying patients who've had to deal with varying things over the years, whether it's a short period, a long period. And some people handle things a little bit better, a little bit worse, and just everyone's different. So it's individualized. But it's just getting to the point where the fatigue doesn't result in the actual burnout, which is very difficult to manage, purely because it results in the sort of physical, mental, and emotional exhaustion. And a lot of people end up only seeking help when it gets to that point, because they're unable to care for whoever they were caring, whether it's somebody at home, whether it's a managerial point at work. HR departments have to deal with a lot of, managing personnel. But that's why we really want to, and I think the important part of this talk is about identifying symptoms, and not just in yourself, but people around noticing these changes, identifying it early and seeking help sooner rather than later.
Yeah, because if you seek help earlier upon recognition, actually fatigue has a higher chance of recovery compared to burnout.
Yes. And I presume that one of the issues is on the professional side, you're just inundated with, as you said, Ling, situations, traumas, stories, and there's, in a sense, no respite for you during the day. For a caregiver on the personal front, here's a loved one, and you want to be able to do as much as you can for them. And there seems to be no end to, you want to be helping them all the time as well. And so there is a question about how to take breaks in there, whether it's drawing boundaries, we'll talk about that later on. But how do you, when you're looking at this, and you have both seen this so many times in caregivers, how do you see it early on to be able to arrest it and not let it get into burnout? Are there signs that people should be looking for, either in themselves or in others?
Okay. So let me start. Usually when I work with caregiver, I usually ask them to also check in on their own well-being. So I start usually with the basic. How have they been sleeping? And how have they been eating? Are they eating? And are they eating well? Are they eating too much or too little? Yeah, sometimes when we are stressed, we are tired, we end up eating too much. So usually I check with any unusual thing. I usually start with the basic, because the basic sleep and eating. And then I'll go on to check about how they physically. Do they find themselves falling sick quite often, which otherwise they won't? So usually I start with listening to the body. What is the body telling the person? So normally I invite caregiver, pause, put the caregiving responsibility aside first. If now I invite you to think about caring for yourself, what is your body telling you? What care the body is needing? So I start with very basic questions.
And you can observe that as well. I mean, people can observe that in their family members, their friends, their colleagues.
Yeah.
That's like the what they tell you on an airline, right? Put your mask on first before putting it on the kid.
Yes, correct.
Which goes against everything you feel.
Yeah. Yeah, and usually that's the part that people struggle, because they feel that they need to do it for the person that they are caring for. Otherwise, they are doing a lousy job, or they are just not being responsible.
Yeah. Tash?
I think just to add to that, it's also, there's looking out for symptoms and signs. But I think even taking a step back from that and looking at some of the risk factors to compassion fatigue. So, for example, looking at almost a role confusion, a lot of family members are thrust into this role of being a caregiver without any training, and they just don't know what to look out for. And it's then thinking, right, I just need to keep going because this is my family member, this is someone I love and care for, and you simply don't want to stop. Another factor to consider is actually sort of looking at expectations. You can't fix everything. It's not a role to fix things or fix somebody you love and care for. The same applies to us as doctors, and I'm sure, Ling, for you, from a work point of view, is we're not there to fix our patients. We're there to take them through the journey and talk them through the various coping mechanisms and giving them the tools to manage. But I think also things like, for example, Parkinson's disease or Alzheimer's, these are things, there's no magic medicine or quick fix. Unfortunately, it gets worse, not better with time. So it's just managing those sometimes unrealistic expectations from the caregiver. It's also a lack of control, because it's naturally frustrating when there are, bills piling up, for example. If as a caregiver you need some respite, do you have anyone who could actually come and take over for a short while so you can have a break? Is that something then you have to look at the cost for, be out of pocket for? And also it's, when you're especially caring for someone within a family, if you're the main caregiver, there are other family members involved. They might be in the country, they might be abroad, and everyone has an opinion on how things are going. So, it's also hard to take criticism, whether it's in a good way or not, to have feedback, and then to sort of, because you feel you're the one doing everything. And also if you yourself, the person who's giving in a caregiver role has a history of personal trauma or burnout in the past. But Ling, as you mentioned, it's about, the main thing is ignoring the signs and just keep going. And that's something that we want to try and pick up earlier and earlier, because the earlier things are picked up and help is sought, the more we can, more support there is out there as well.
Correct.
So why, all of this makes sense, and all of it logically, most people would say, yes, I have to take care of myself and all that. And you've mentioned a couple of reasons why people either refuse to observe those issues or just try to power through them. Okay. Are there other reasons? I mean, couple come to mind, like ego. I can handle this. I'm Superman. I'm Superwoman. I can do it. Okay. Well, guess what? You can't all this, right? Are there other things that you've seen in the caregivers that you're dealing with or have dealt with? Other reasons why they don't reach out for help or don't observe that they're hitting a wall?
Okay, some caregiver I see is they have this sense of anxiety on letting go, especially if they have to let go to someone, say for example, a stranger. Maybe they pay money to hire someone stranger to come in and help. I think they have anxiety because they're so used to taking care. They understand the needs of the loved one so much compared to a stranger. So they will feel that, oh, what if this, I bring this person in, can this person take care of my loved one based on what I have been doing for my loved one? And if this person cannot, and I cannot expect the stranger to be able to perform, provide care at that level, am I then not doing my job? Why did I hand over to someone who is a stranger? That's one of the things I hear fairly common among the Chinese.
Right.
You know, we do struggle because in our culture, to us, it's like, you know, we try to keep things within the family as much as possible. And for us, it's also because of a desire for privacy. We kind of find it very hard to open up, to invite a stranger into our life. And also, sometimes it could be our loved one not comfortable to want to get to know another person. So then it becomes very difficult for the caregiver. The caregiver may need, may want, but if the loved one doesn't want, then this is where it's very difficult between the caregiver and the loved one. So sometimes I think that is the struggle a caregiver face.
Yeah. Tash?
Yeah, just to add to that, actually, and this is stemming from one of the previous talks this morning about Asians seeking help. You mentioned, Nels, even just now about being superheroes. And this was in the summary for this, in the description for the panel, the carers are not superheroes. I think most of us think we do. As a doctor, as a psychologist, counselor within the profession, we all think we can absorb so much, but it gets to a point where everyone has a breaking point. And I think it's very important to know your limits. And I think from a carer point of view, and again, for me as a doctor, I get to know my patients. I know how to manage things. If I'm away on leave, for example, and somebody else has to manage it, it's also the patient has then gotten to know you. And I'm sure, Ling, you find this from a psychologist point of view, that then you almost have to start over again, in a sense, if it's a continuation of an ongoing problem.
Yeah.
But also it takes a lot of courage to ask for help. And I know that for a fact, you know, personally, we all think we can just keep going. So it's also, I make it a point to actually thank and congratulate my patients when they finally come in to see me, because it's a huge first step. And I think asking for help is difficult, but it's also having the right support network around you. But a lot of people don't have that, or it takes a lot of time to get to that point. So it can always be difficult to feel comfortable to ask for help.
From the caregivers, sorry, go ahead.
Oh, I just want to add on, I think apart from courage is also what meaning do they attach to seeking help? Some people will see it as, oh, I'm failing, I'm lousy, I'm no good. And it's very hard. So I think sometimes it's the psychological barrier, the meaning that they attach to seeking help. If they could see that, okay, is to recognize the limit, I don't want to break down, and I have my window of tolerance. I don't want to go beyond and I break down completely. So if we can help ourselves to switch that thinking, maybe that would be easier to find the courage to take the first step.
I was going to say, from a caregiving point of view, things which affected me, one was fear of judgment, which you mentioned before. Oh, you mean you can't do this? And, you know, why can't you handle this? The other was a fear of the reaction of, we'll call it the patient, the individual. Oh, you don't have enough energy to take care of me. Okay. And well, part of that is true. That's a difficult discussion to have, whether that's with as you said, maybe someone going with Alzheimer's who's in and out of different stages. That's a tough conversation to have, and their reaction can take a big toll. And I see that in dealing with the elderly frequently, I'd say. So, and I guess, so how often do you see people getting to that fatigue and then burnout stage? What, even just rough percentages of the patients, therefore the caregivers that you deal with professionally?
Hey, Ling, do you want to start or?
Okay, I'm just
Sure.
thinking about a figure. I think
Okay.
compassion fatigue, I see it more frequently,
Yeah.
you know, maybe 50 to 60%.
Okay.
So, but burnout, I would say less than 10 or so. And okay, because I see professional as well, not just,
Yeah.
so I tend to see more burnout happening in professional. So the professional I see are people in the helping profession.
Yeah.
So I noticed that people in the helping profession, I guess because of our training, we tend to find it harder to step up to seek help. So when they come and talk with me, I realize that, whoa, you're very close to burnout. And some actually is at the start of the burnout. So I tend to see professional when they seek help is almost at the start of burnout or is very close to burnout. Yeah. And that's the thing I'm concerned about professional, because day in, day out, actually they do face compassion fatigue.
It's very hard actually to put a number on it. But you know,
I'm a math guy. I love numbers. Just give me a break.
So actually, coincidentally, this morning, Dr. Neil Forrest, who's one of actually shared an article from Channel News Asia, and it's on this morning. Actually, they actually commissioned a survey of mental health across 6 Asian societies during the pandemic, which actually showed for Singapore, between the ages of 18 to 39, it was actually work-related burnout and not the COVID-19 restrictions that affected mental health. So, you know, it's from a numbers point of view, and this was sort of 57% of the respondents. And this changes depending on where you are, but it's just interesting to see that from whatever the role, whether you're in a caregiving, whether it's a work-related, when you just put your head down and you focus on that role, you just feel like you can keep going. But it's trying to catch things early rather than waiting from a burnout point of view.
Right. So there was a comment in the Q&A that this applies to a caregiver of any race. The ability to let go and allow an outsider to take care of the loved ones and feeling that they cannot take care of them as well as we do, the need to put up a front, keep it a private matter. And I would agree. I think every culture, a lot of people would face that same challenge. Do you see a difference in, we'll call it the generational side? So, and some of this may link into the race as well, but people in their, well, different ages, how they respond, how they are more or less willing to reach out for help. Is there any difference in there that we can take some notes from?
Yeah, if I can comment on that, absolutely. I mean, I've worked in the NHS as well as the private sector in London, and then looking at my work in Singapore as well. I find that the younger generation, you know, 20s, 30s, even early 40s, maybe because of social media, there's a lot more news out there. People tend to seek help just that little bit earlier. Whereas as you get a little bit older, you're off that sort of thought process that, you know, my parents never asked for help, my grandparents never asked for help. I don't need the help because it's not something that I grew up with asking for help. But I think that's changing, which is for the better. Because what we don't want is for people to be coming to seek help at the burnout stage. We want them at the earlier stages.
Right.
There is still a difference, but from patients I'm seeing, and I'm sure it's the same for Ling, is that it's getting better and people are seeking help just that little bit earlier.
Yeah, I agree with that. I see more and more young people nowadays stepping forward. And I also think it's because of public education. The meaning attached to seeking help is changing. It's really then you do not seek help at the last resort, but rather you seek help also as a preventing measure. Perhaps you're coping better, but how can I do it even better? Or maybe there's certain thing I'm already doing better. If I can go talk to someone and find out, is there another way of doing it? So I think the meaning attached to help seeking is changing. And I think that is a good sign. Plus also, I guess now in the different institution, they make it available. Like, in every uni, in every school, they have already put in the resources of school counselor or the student wellness center. So I guess it's also availability. And the fact that it is getting a norm, like it's like not seen as, oh, something must be wrong with you. That's why you're seeking help. So I think it's got to do with also acceptance among the peers.
Right. And I'll just a little side note, people who are participating, feel free to throw questions out there through the Q&A or the chat, and we'll get to those. In terms of the caregivers, do you see any difference in some caregivers would want to reach out for help from family members? Is there a benefit sometimes in having a stranger, when I say stranger, not complete stranger on the street, but somebody not as close emotionally? Does that sometimes help the caregiver, or do they tend to, what you've seen, reach out to the people who are closest to them for help?
Okay, maybe I offer some perspective from the family I work with. I noticed that if, let's say, the family relationship, say for example, taking care of elderly parents,
Yep.
Okay, if the sibling relationship is good, I find that they offer very good support for one another. But in family, if let's say the sibling relationship is no good, sometimes, like what Dr. Tash said earlier, sometimes you disagree with your own family member, then they spiral another set of tension, conflict, stress. Then that's the time where I see them, it's better that they go for external help. And that will give them a space. Because if you were to go back to a sibling that they cannot go with, instead of help, I think it's more stress.
Right.
No, absolutely. It's also, I think sometimes it's good to have an outside perspective. Because I appreciate that, sometimes you want to have that privacy, you want things to stay in the family. But having that external source where somebody is just thinking outside the box for you actually is a huge thing, be it somebody you find, a close friend, a stranger in the sense of a psychologist, a counselor, your general practitioner, even someone you work with if you feel comfortable enough. But I think it's important to have and even be part of a support group, because at the end of the day, everybody feels they're going through these things by themselves, but they're not. There are many, many people out there in the same situation. So I would always even recommend just a peer support group, a caregiver support group. Even if you don't feel you want anything more than that, it's just nice to know there are other people out there who are going through the same pressures and strains as you are.
Yeah, every situation is unique, but there's a lot of overlap and a lot of commonalities that we can benefit from talking with others who are going through it or have gone through it. I found that out a bit too late, but yes, I found that out. And that was a big lesson for me. What other support can families and friends give their loved ones who are the primary caregivers? Beyond, okay, take a break, I'll take over. What other things do you find work? And some of it is individual. Some people like to have some solitude. Some people just want to go out and party everything, forget everything. But what tends to be we'll say the best things that loved ones can do for their loved ones who are caregivers?
So if I start, Ailing, if that's okay, I think it's having an open conversation from the start and having a plan, even if it's not the clearest of plans, it's making sure that the entire family is on board from the get-go. I think one of the issues that families, especially larger families, can have is that one hand doesn't talk to the other. And then when there is that conversation breakdown, that is when most of the issues, the judgments, the general fights can set in. So I think that open conversation, but it's also being present for whoever the main carer is, not constantly giving your opinion about things, but asking and finding out what is it that I can offer, especially if you're not actually in the country or in the area or close enough. And just simple things, as we mentioned earlier, about respite care, just having that, even if it's a day, half a day, something.
An hour.
An hour, exactly. Sorry, let's start with that. And then, it's also for that caregiver to have the confidence to know that that whoever they're caring for can actually manage without them for a short period, and then to build it up.
Right.
So that's really important.
Yeah. And to add on, I guess it's also this thing about affirmation, especially sometimes in the course of caring for your loved one, accident does happen. And it just happened. There's just no explanation, So I think it's when such thing happen, how does the family process the whole thing? Are they able to recognize that, okay, it has happened. Let's not blame anyone, and let's see how we can put our heads together and see how we can prevent it from happening. So I think that is also, along with open communication, is it able to speak it as it is, and let's find a solution together. That's one thing I find sometimes could be lacking, and people can feel safe enough to say that without worrying that, oh, I'll be judged, I'm doing a lousy job, And also sometimes it might be true, when you are the one keep doing it, you cannot think of any other way. But talking it out, someone can see it from another perspective. Why don't you try this? Why don't you try that? And if we can get that going, then there's the collaboration, and it's the co-creation of, okay, we own this problem together. There's a co-creation of the attempted solution. And I guess that will strengthen the bond and the sharing of responsibility.
I think that's a very good point, that others can see things because you get so blinded in your approach, your situation, and you're just trying to get through to the next hour. And so, okay, a more difficult topic. So it's all difficult. Have you seen cases where somebody just says, I have to just keep going because if I don't do it, either because there's no other family around, or there's the disagreements within the family, or the person's just too stubborn to think of something else, and they get to the burnout stage, their mental health is affected, and they can't see that. How do you what can people do to pull them away from that situation, showing compassion to them, but without affecting the care of the individual as well? Because we'll see this with, I'll say definitely with the elderly, looking after whether parents or spouses, two 85-year-olds looking after each other. There's, nope, I can do it. I can take care of him. I've taken care of him my whole life. What can children or loved ones do to help in that situation without, you talked about affirmation, whatever the opposite of affirmation is, without de-affirming them?
So from a sort of general practice point of view, it's trying to get, if there are the family members, the children, for example, trying to maybe have a joint meeting where, without pointing fingers, you're almost sure where certain extra aspects of care is needed. So especially, as you mentioned, Nels, if there are two 85-year-olds and one needs extra support, maybe if one party is having more infections, there are sort of things like bed sores, or they're struggling with constant like urinary tract infections. It's just bringing all of that to the table to see, right, what can be done, and then almost opening the eyes of the carer to show that there are extra things that can be done, but they need that extra support. Now, it's not going to happen in one go, but I think it's just a conversation starter, but that's where that communication piece makes a big difference, trying to get everyone together and to start that conversation. And I think I found that makes a big difference, actually.
Yep, I agree with that. Getting the family together to probably have a conversation to review what's working well and how is everyone at it, and how can we kind of chip in and kind of continue to do it. And I guess it's also engaging the person who needs care to also probably give some suggestion of how can the different member of the family be supporting that person. So then it's like, hopefully when it's from the one that need care and the person can kind of describe what each one can do, then in that sense, hopefully it kind of open up the mind and the perspective of the person, the primary caregiver. And I guess if it's coming from the one that he or she has been caring, I guess it's easier to hear.
Right.
At times.
Okay. Question which has come in, and I recognize we only have about 5 minutes, I think. As a caregiver, there is a lot of guilt of not taking care of the loved one well. We talked about this earlier, the guilt of not being mentally and physically present for other aspects of our lives with our partners, children, work, friends, not being fair to ourselves. How can we as caregivers not run ourselves to the ground trying to be everything and everywhere at the same time? We've talked about some of this, but and some of this is, I guess, being aware. Being aware is half the battle at times. But how does a caregiver overcome that guilt of I'm not doing well enough, or if I take a break, I'm failing? Is there there's no magic solution, but what are a couple of quick tips on that?
Okay, I will offer and suggest affirm yourself. Okay, what do I mean by affirm yourself? It starts with being kind to yourself. Okay, being kind to ask yourself, what have you done well? And what is it that you like what you are doing? And of course, there's also a part of us, we know we have limit. Then it's also to state that limit. Okay, what is the limit? And with the limit that I have, what can I do about it? Do I need help? Maybe I can do it better with some help. So then it's to allow yourself to go and ask for the help or to receive the help, and to know that by asking is really then is to strengthen your limit. So you don't get sucked in to say that, oh, there's nothing I can do about it. Right? So I think there's also this thing about being kind to yourself, to celebrate small victories. Not every day is going to be a sunny day. There'll be some days that's gloomy, but don't worry, the sunny day will come back. So celebrate the sunny days and realize that, the stormy days will pass too. So always remember, keep holding on to the small victory that see you through the storm till the next sunny day comes.
Okay.
Gosh, that was so well said. I feel worried to comment any further.
Exactly. If you get the right answer.
Absolutely. I think just one thing to add would be, again, going back to being on a plane and getting that oxygen mask on your child before on yourself first before your child or whoever you're looking for. I think you need to, as a carer, aim to look after yourself. And I'm talking simple things: nutrition, exercise, and sleep. And that all of us should be doing. And that's something we're really pushing for, is if we can get those 3 things right from a boundary point of view and a resilience point of view, you'd find that you're able to actually keep going that little bit further because you're actually taking care of yourself. And that's very important. And I think whether you're a caregiver or not, everybody should be doing those 3 things.
I now see we're out of time. So before they cut us off, I want to thank Tash Ling for wonderful session, lots of useful hints. Listen to your body, affirm yourself, get in a support group, whether that's family, friends, or otherwise. And we should all go and be thankful for all the caregivers out there. So thank you both. Thank you for everybody participating, the questions and the emojis.
Yes, thank you for those.
Okay.
Thank you, everyone.
Take care. Thanks, everyone.
Take care.